Good afternoon, everybody. I'm going to start by taking my lanyard off. So good afternoon, everybody. Welcome to our Q&A session that we do for media on Thursdays. It's our opportunity to answer questions that have been given to us in advance about COVID-19 and to share some basic information for you that is an update from last week when we were together. Today is October 8th, and again, thanks for joining us for this COVID-19 update for the Chippewa Valley. We are sharing Eau Claire data as well as state data, a few state and local updates, and then I'll answer questions. A reminder to media that if you'd like to put a question in the chat box, you can also do that. And at the end, Audrey, who is in a different room from me, will share those questions so that I can answer those. I do, again, want to say that the health department, like all of us, are working together on really making sure we slow the spread of disease here. So one of the reasons that I'm able to take my mask off and have this update with you without a mask on is that we are working, Audrey and I, the person that supports these media casts happening, we're working now from separate rooms. And it's one of the strategies that we decided to use after first having a few of these media casts with me with my mask on. Because we were in the same room, we decided to work together to make it work so we could be in separate rooms. We know that all of you are working on finding creative strategies to make things work, whether it's at home or at work. So thanks for your continued work on that. Again, we do it here because if I had COVID-19, I can't risk spreading that to others. If don't have symptoms and don't realize that I have COVID-19, wearing a mask and using distance really makes a difference for the team that we have at the health department. Just like all of you, it makes a difference for your family, your coworkers, and your friends. So a state status update, as we do every week. The negative counts for COVID-19 tests that have been done in the state are now at 1,506,828, an increase of over 72,000 COVID-19 tests that were negative since last week. We now have 141,830 individuals in Wisconsin that have been diagnosed with COVID-19. That's an increase of almost 17,000 people since last week, Thursday, 3,312 people COVID positive since yesterday. It is the highest single day count of cases that we've had in Wisconsin. Certainly, the state is being seen, unfortunately, across the nation as a place where there is high disease spread. Wisconsin has been named as one of the highest spread states in the U.S., and many of our communities across the state are being identified as communities where incredibly high disease spread is happening. It's certainly not the place we want it to be. In Wisconsin, 8,061 individuals have been hospitalized for COVID-19 at some point. An increase of 652 people in Wisconsin that have ever been hospitalized. And we now have 1,424 Wisconsin residents that have died related to COVID-19, an increase of 76 individuals since last week, Thursday. This week, the state not only had incredibly high COVID positive numbers, but also set a record for COVID-19 hospitalizations. Every region in the state is reporting shortages in some way, shape, or form for hospital capacity. The state also is recognizing that there is a challenge with contact tracing, disease investigation, and contact tracing work across the state. And the entire state is seen as being at very high activity level. Across the state, we're seeing all age groups that are seeing an increase in number of cases. It's not just in a single age group. And the 7-day positivity rate is increasing. It's at 17.4% at the state level, 9% for Eau Claire County. The Eau Claire update. Our negative test numbers now to date are at 24,352. That number is one that we are continuing to work on, as are all counties across the state, with the new state update of their electronic system, to make sure that we pull those numbers quickly into our jurisdiction or into the county where the test happened. We're still working through that backlog with the state, and we should have a fuller and more complete picture of our negative test results soon. Our positive case numbers are now at 2,264 individuals in Eau Claire County that have been diagnosed with COVID-19 since the start of this pandemic. 248 since last week when we last reported, and an average of about 35 cases per day. Again, that daily case count and the weekly and every 2-week case count is certainly much higher than what we were hoping to have at this point. Again, we are not expecting to be at 0 cases, but our goal was to be at, and the goal that was identified at a state and national level was to be at about 10 cases per day for a county of our size. Again, the positivity rate for Eau Claire County is 9%. And we are continuing to have cases across the age group. Our age group of 18 to 24-year-olds is about 50% of all of our cases, but that percent is decreasing slightly. So a slight decrease, 2% from last week of that 18 to 24-year-old age group. We are seeing cases of COVID-19 across all ages. As of Monday, October 6th, 33% of all cases since the 1st of September are affiliated with UW-Eau Claire. That's an update that we've been giving to you weekly since school started at UW-Eau Claire. And again, this is a decrease in the percent of total cases that are UW-Eau Claire related. Again, showing that we have disease spread across the county, not just in one particular age group. Of the individuals that have had COVID-19 in Eau Claire, 2,009 have met the definition for recovered. That does mean that we are actively working with 255 current Eau Claire County residents who are isolated for COVID-19 and who are potentially infectious. Of those people in Eau Claire that have had COVID-19, 71 have been hospitalized. 12 additional people since last week, Thursday, again showing how we are seeing increasing hospitalizations across the state. We now have 8 individuals that are Eau Claire County residents that have died from COVID-19, an increase of 1 additional person since last week. That individual was over the age of 65 and did have underlying conditions. We also share with you every week the public health investigations that get reported on the state website. Again, a reminder that that state website reports when there is 1 case in a long-term care facility, or if there are 2 or more cases in any other setting that is a shared setting outside of a household. Our public health investigations list 36 active investigations for Eau Claire County. Again, this is on the state website. There are 13 active long-term care facilities. There are 11 other settings where there are public health investigations or 2 or more individuals, 5 workplaces, 5 educational facilities, and 2 group housing facilities. Those are our current active investigations. I will share with you, because this was in the media earlier in the week, that the state has had an open records request related to these public health investigations, so the type that I just shared with you. That state open records request means that the state was asked to share the names of all of those other facilities that are listed. The state has not done that to date following that open records request, but was getting ready to release those names based on the requirement that we have as government to share in an open records request the requested information. And there was then last week a legal case that was brought forward to hold the sharing of that information, which did happen. So the information hasn't been released, but I do want to share with the public and with our businesses that those places, educational facilities, workplaces, group housing facilities, and other settings where there have been public health investigations, you've worked with us. You've made sure that there isn't further spread of disease. And we really want the community to know that if and when those names get released, that it isn't a comment on the hard work that all of our workplaces are doing to slow the spread of disease. It just means that 2 or more cases were identified at that specific facility. And that could happen to many, many places if people aren't being careful about spread of disease, both at work and away from work, and they happen to work at the same location. We'll continue to message about this if those records are released, but do know that we are working closely across the community. Again, when we have a case or multiple cases in any one workplace, we work closely with that workplace to slow the spread from that point forward. The state rating for COVID-19 activity level in Eau Claire is at a very high level. We also report jail data at this point, and our jail data as of Monday is that we have 165 individuals that have been tested through the jail, 10 positive cases of COVID-19 with 8 recovered. A couple of additional things we'll share. Last week, we talked about our Augusta one-day testing event that we did last week, Wednesday, to really provide an opportunity for testing connected to some increased cases that we were seeing in the Augusta area. We did that testing event with the Wisconsin National Guard last week, Wednesday. 75 individuals were tested during that event, both people from the Augusta community, but also from the surrounding areas. We are still waiting for all the details to come to us about the potential positives, and when we have that, we will share that. We also have been working closely with the Wisconsin National Guard on putting together a state-requested regional testing site. That community testing site has been up and running since last week. It's a 3-day location that on Fridays, Saturdays, and Mondays we have available to us. It is in Eau Claire on the far western side of our county, near the intersection of Highway 94 and Highway 312. There's signage there, and there is good information available on our website about how to get to that exact location. We do hope people take advantage of that free testing site for COVID-19 testing for community members across the area. It is a place where if you sign up on the app in advance, you can quickly get through and get tested. You can also sign up on site to get tested. For both symptomatic people and those that are close contacts, this is an additional resource in addition to the healthcare testing that we have happening now. And healthcare is a critically important partner as we work on making sure testing is available for anybody that needs a test on any given day. We will continue with this more permanent testing site through December. So the National Guard is committed through the beginning of December to be in Eau Claire County on those 3 testing days, Friday, Saturday, and Monday. My enormous thanks goes out to the Wisconsin National Guard personnel that are doing the testing at that site and being an enormous resource in this area, and to the local staff that are working to help support that as well. We also have some area businesses that are leaning in and really providing things like water and support to the team that's out there testing. So an enormous thanks to them as well. We did have this week a new state order. The state health officer did a new order for the state as a whole related to public gatherings. That was announced on Tuesday and took effect today, Thursday. That there are now limitations on indoor public gatherings in addition to the face mask state order that was issued earlier. It was announced by the governor on Tuesday, and the intention, given the rapidly increasing numbers of COVID-19, was to really work on having smaller indoor gatherings. The guidance in that order is, the requirement in that order is that indoor facilities are reduced to 25% of capacity or 10 people or less for some very specific indoor public spaces. And there's a lot more detail in the order about that. There were exemptions to that order, but it was put in place for a short turnaround time, so 4 weeks or 2 incubation periods for this specific disease, to see if smaller numbers gathering would help lower our rapidly increasing case numbers. So it's a specific strategy that the state is using to try and slow spread. This order does apply to settings indoors, those public settings. There are a number of exemptions to that state order, but the local order is also still in place. So this state order does not mean that the local order is not in existence. The local order still is in place. And in those places where the restrictions for the local order are present, those are still things that in Eau Claire need to be followed. Again, our order is really strategic around risk factors. So whether you're indoors or outdoors in a public space, 6 feet distance does need to be maintained, and the reduced occupancy does need to be retained. We know for some it's been confusing as the new order came out, and even we did not get advance notice of that. We're working through the explanation and the resources so that we do have materials and information available for all of you as you are trying to problem solve what this new order means and how it compares to our local order as well. The primary change for some of our indoor spaces is that rather than 50% occupancy, which is in our local order, now the requirement from the state is to be at 25% occupancy. I would highlight for all of us across the public arena that our local businesses need our support, and this occupancy limit is to slow spread, and it's important. But it's also important that we find creative ways to support our local businesses. So, for example, if you are able to get takeout at a local restaurant, please do that. We all need to have our restaurants stay open and strong, and they need our support. We need to slow spread of disease, and they need our help not only in supporting their business, but also doing the right thing in our community. Wear your mask, stay home when you're sick, keep 6 feet distance. If the state can see that the numbers are flattening and that the 4 weeks of that incubation period result in some better outcomes, we'll be in a better spot to not have this type of statewide order. So we need all your help. We need you to not only support the businesses in ways that you can moving forward in Eau Claire, but also do those practices that will help slow spread even without the state order. Our metrics are also something that we share with you every week. Once a week, it's our snapshot in time to say, where are we at in Eau Claire County? And what does that mean for what we have to be doing locally to make sure that we are staying on top of being as healthy as possible with this pandemic? Those metrics are available on our website, covid19eauclaire.org. You just click on the button that says more data, and at that site, you'll see a document that shows our red and green measures that we are tracking every week. Our case count over the last 14 days is at 508, which is still very high and in the red. But it is a decrease from the previous 14-day period, which is good news for us. We have had 9 outbreaks in the last 2 weeks, which remain red. And our community spread, also remaining in the red, is at 38%, a slight increase this week. Our positivity rate, again, it went down a bit, is at 9%. It's now in the yellow, which is good news. Our case contact percent is 78%. So that means of the cases of COVID-19, the positive tests that were done, we've gotten to 78% in the first 24 hours, which is critically important. So people know they have COVID-19 and they need to stay home. That is in the yellow. So it's still not where we want it. We really want everybody to know right away and make sure that they understand that they need to isolate. And we're working on that by increasing our capacity for that kind of disease investigation. Last week, that percent was in the red, and now it's in the yellow. Contact tracing, though, is still at 36%. So 36% of people that are close contacts are contacted. And that remains in the red. That's still a lot lower than what we would like them to be. We do want the community to know that if you are told by someone that is COVID positive that you are a close contact and that you need to stay home for 14 days to quarantine, please listen to them. We need the spread of disease to slow. All of us need that to keep our businesses and schools operating in the most effective way possible. And if we have more spread in those close contacts, if those close contacts don't stay home and they spread disease when they are asymptomatic, the circle of disease spread is greater. So it's critically important that people follow the requirement to be quarantined for 14 days if they are a close contact, and that we support each other in doing this. Again, a reminder that this is a serious disease. Yes, some people have mild illness, but 1,400 people in Wisconsin have died over the course of the summer from COVID-19 during a time frame when we usually have all but no respiratory-related deaths. During the late fall and winter, we have people die of respiratory illness, it is true. And if this was happening just during that time frame, it wouldn't be as concerning. But we do have a lot of deaths happening, and they are deaths that are not expected during those months. We don't want to see any Wisconsinites die of COVID-19, and certainly this number of deaths continues to be concerning. We also haven't had enough time with this new disease to study the long-term impacts of COVID-19. And it's a reminder to everybody to understand that with a new disease, this is not the common cold or influenza. This is a new disease that we don't know long-term impact of. We are learning more and more from the research about long-term cardiac and respiratory problems, both heart and lung problems with this disease. And we need to be concerned about that. And the research that is being done is critically important for us to understand, what does this disease look like over time? We have tools at our disposal to work on this. Simple things that all of us can do that don't take a lot of effort. Wear your face mask when you're out in public. Keep 6 feet distance in all interactions so that we decrease spread of disease. And really do the hard work to stay home. And if you're sick, get tested. Both stay home and get tested if you have any symptoms. So on that, I'll remind everybody, go to our website, covid19eauklar.org, and get more information there. You can also call our call center and ask questions if you can't find information at our website. That number is 715-831-7425. And with that, I will answer some of the questions that came in from media in advance. And then again, a reminder to our media partners that are on the call that if you would like to ask any questions, you can do that via chat, and Audrey will share those with me, or you can unmute once we get to that point and ask your questions. So the first question that I did receive is, with the new emergency order on occupancy limits, so the state order, who will be enforcing that? And is it up to the health department to issue citations or local law enforcement? The state order didn't designate specifically who is responsible for enforcement. It is a citation authority that is given to local government. In this community, our practices have been that citation authority rests because of a health issue with the health department. So I'm expecting, as we work through this specific order, that our process will include again, the very critically important education pieces, which we do. If we get a complaint about a violation of an order, our first step always is education and really working with an entity to find ways to make things work for them. We do that with a team of people that really is looking for the outcome of increased health opportunities in this community and slowing the spread of disease. So as always with the state order, we would start with education. In those small circumstances, and in this community, hopefully no circumstances where entities are choosing not to follow the order and are putting people at risk, we would then work with our legal counsel and the local DA's office to issue citations and to have that process be in place. Again, our goal continues to be to work together and to make sure that we are a team of community partners slowing the spread of disease. And that team includes all of our local entities across the community. We don't want and we don't need in this community super spreader events. And it's ironic to me that it's become common language. Everybody now knows what super spreader events mean. But this new order is really partly about not having events or situations where large groups gather and where spread can easily happen. The next question we have is, does the health department have any idea about why cases are beginning to slow this week compared to the previous 2 weeks? As I reported earlier, our 7-day and our 14-day case counts are going down a bit. They're still very high, about 35 cases a day, which is well exceeding that level of concern. Again, nationally, anything over 25 cases a day is considered very concerning. But it has come down a bit, which is really good news. It's likely a variety of reasons. And as we all know, people getting tested is an important part of the dynamic. There is a bit of concern that some people may be choosing not to get tested that are symptomatic. And not only do I understand that, but I also need to say that we need to get tested if we have symptoms. All of us need to encourage friends and family to get tested if we have symptoms. The next circle of disease gets smaller if we quickly have tests happening and we quickly identify who could be spreading COVID-19 to others. So I'm counting on everybody to make sure that you're getting the message out there that if you have symptoms or you are a close contact to someone that is COVID positive, get tested. We also know that in the beginning of September, we had a number of people coming into our community because of UW-Eau Claire starting that did get tested, and that did increase initially some testing numbers at that point in time. And as UW-Eau Claire has reported, and we've reported those bigger increases in numbers of UW-Eau Claire connected cases happened early in September, and that's slowed down since that point in time. People are now in our community, settled in, and the spread past that initial point appears to be fairly limited, although, again, we're concerned about continued spread in the community of COVID-19. We're expanding testing, and as I shared earlier, the work that we're doing with healthcare to make sure testing happens and with our Wisconsin National Guard sites for testing to happen are part of how we're making sure we know about positive cases in our community. We also have a question about hospitalization metrics. So have hospitalization-related metrics improved at all this week compared to last week for Eau Claire County? And how does the health department feel about the current hospitalizations? Last week, we were fortunate enough to have our hospital partners on the call with us talking about concerns and data related to hospitalization. As I shared with you earlier, we had an increasing number of hospitalizations in Eau Claire County. And our regional data, which is how it's reported on the state health department site, does show increasing hospitalization rates across the state. So we continue to track that, and we are overall seeing increases. At this point, our local hospitals are able to treat all patients, and I highly encourage people to not hear or assume that hospitals are tapped and they can't go to hospitals if they need care. Please go to the hospital if you need care for any reason, whether it's COVID related or not. Our hospitals do have capacity. But we are watching the increased number of COVID cases in hospitals because it's an indicator to us that we are having more concern happen. So we'll continue to watch that. We continue to work closely with our healthcare partners to track that and to be sure that we have available space in hospitals to treat people with COVID-19 and available staff to do that work. We are fortunate that we have an amazing healthcare system available to us in Eau Claire County. We also have to remember that that healthcare system, our hospital system that is here, serves a region, and we need to work together across the region to keep numbers of cases as low as possible. We also then finally received a question in advance about whether or not the health department is involved in planning of any potential hospital overflow facilities, like the field hospital that's being planned for the State Fair Park. The state did announce this week that they were starting to deploy people to be ready to open the State Fair site for overflow for hospitalization of COVID-19 patients. That was something that had been put together many months ago as an option, and it is now being readied for use in the southeastern part of the state because of concerns about increasing hospitalization rates for COVID-19. In this part of the state, in Eau Claire, we had similar conversations early on with our region as well as here locally to have an alternate care site ready to go if we needed that locally. We did do all that advanced work and planning. We are ready to move forward in considering a site here locally if that's needed. But at this point in time, our hospitals are in a place where they are not needing that kind of urgent move to an alternate site. And we do have a state site available for us across the state if that's needed. So our first plan is to use the state site if that's needed. And then certainly, if we are starting to utilize that site, to reinitiate planning locally for a local site if that's necessary. So I will now pause to see if there are questions in the chat box.
Yeah, Liska, we have a question that came in about mask wearing and then getting sick with COVID. So here's the question. For people who have tested positive, is there any data to show their frequency of wearing a mask versus not wearing one? And is that a data point that's tracked to get a better understanding of how effective wearing a mask is?
Yeah. Thank you for that question. So this question really gets to the core of wearing a mask. And are we tracking real-time data to look at whether or not wearing a mask, if an individual that is COVID positive is in a setting where they may have had close contact, does wearing a mask of that individual or wearing a mask of people around them make a difference in disease transmission and seeing if they are passing the disease or others are getting COVID-19 from the person that was COVID positive? That is a really important research question, and interesting that you're asking that now because our local team as well as the state team has been looking at that. Our current data system in Wisconsin does not have a field to track whether a mask was worn by the individual that is COVID positive. It's a newer issue, and we know that typically at a national level, CDC would be working on updating all of their case investigation forms and updating the data to start tracking things like this. And a difficult commentary on our national response is that we have not been getting that type of direction at a state and local level to do the important work that results in us understanding the disease better at a national level. There has been some specific research projects done on spread of COVID-19 with mask wearing, and overall at a population level, there's clear evidence that in communities where mask wearing is prevalent, spread of disease is lower. So again, it's looking at not the direct one-on-one spread of disease, but at a community level. What do we generally see when mask wearing is higher? We generally see lower spread of COVID-19. And again, that is really an indication that masks really make a difference. We talked about that when the mask order first came out at a state level, and we've talked about it when we've really encouraged people to wear a mask as part of their just basic practices to slow spread. Having that one-on-one, not correlation data, but actual causal data, which would be gotten from really looking at more case-by-case information, is important, and we're hoping that that comes soon. We don't have that local data now.
That was the only question that came in advance in the chat box. So I'll ask any of our media partners who are online with us, if they have any questions, please go ahead and unmute. I think that's all the questions for today.
All right. Thank you, everyone, again, for joining us. We appreciate you learning more about what's happening with COVID-19 in Eau Claire. Again, an encouragement to go to the website for more information, and we will be back next Thursday. Thanks much.